Good morning to those who are signing in. We'll start up right at 10 o'clock. We're just giving you a few minutes to log in. For those logging in, we'll start up in about 3 minutes, right at 10 o'clock. For those signing in, we'll start up in about 2 minutes at 10 o'clock. Thank you. We'll start up in about 1 minute. Thank you. Good morning, and welcome to another town hall here with the Cornell Local Roads program. My name is David Orr. I'm the director here at the Cornell Local Roads program, and today we're going to be talking about summer plans, things that we've learned over the last now 50 days with COVID-19. I know some other folks are going to be signing in here, so while they're doing so, let me give you a couple of ground rules and get a couple of things started. Just as a reminder, we're doing questions via the question and answer pod. You take your mouse near the bottom of your screen, and you should get a bar at the bottom. The chat has been disabled, but you could raise your hand, but better yet, put a item in the question and answer pod. We'll make sure we go through those We have some we've shared with the panelists ahead of time as well. We'll go through those as well. I'll do a quick introduction of who we've got to read the names to you, and then I'll unshare my screen for a sec so you can see everybody. We have Joel Kai, Town of Dickinson, and the president of the Town Superintendents of Highways Association. Mike Basil with the Town and Village of Palmyra. Alex Greger from the Town of Southampton, the end of Long Island. Case Witten, the Town of Sherburne. Andy Avery with Chemung County and the City of Elmira. John Papinetti with Orleans County. Kathleen Ellis with Cattaraugus County. Fred Penna with Putnam County. Sarah Hill joining us from AGC, and Rob Fitch with the New York State Department of Transportation. So I'm going to quickly stop for just a second. Everybody can see all the people that are there, that are on our panel that we're going to be hearing from today. People may come in and out because of the nature of the way the internet works, but that's the way we're going to make it work. Okay, so I'm going to come back over here and bring the questions up on screen. And before I forget, one more thing. Okay. So as I said, we sent these questions out ahead of time, and so we'll show the first one here. And this is, we have asked this question somewhat before in one of the earlier town halls, but you know, enough has changed. So I want to get a little update from folks. What changes have you made to your summer plans? So anybody want to go first? Any brave victims? I mean.
Sure, David, I'll go first. It's Joel. Obviously, because of the sales tax revenue and stuff like that, we've had to make some adjustments in our budget, which is cutting back some of the things that we might have usually done. We're probably going to do a little less paving, a couple little parks construction jobs that we had that we're going to set aside until later in the year and see how things go.
Okay.
David, this is Andy. We're similar in Chemung County. We've reduced our capital spending plans already by 20 to 30%. We also, we're not going to be hiring many seasonal employees. Usually we're hiring about 20 seasonal employees. We're probably only going to be allowed to hire 3 to 5 that are critical for us, such as at our compost facility. You know, Joel talked about sales tax. We also rely on room tax. We get money from the casinos. All those are down for us. So we're not hiring, we're in a hiring freeze. We're not hiring full-time positions right now. We're not filling them. We're not promoting people. And, you know, it's different, but we're going to keep things safe and keep moving forward.
Mike or Alex, what are y'all doing? You're muted, Alex. There you go.
Am I good?
We got you. You're good.
Down here on the flat, we're kind of waiting to see what the May 15th brings along. We're still having more people going in the hospital, so we're still working at 50%. I have the guys coming in every other day. You know, instead of 8 people per district, I have 4 coming in. We are trying to ramp up the shop a little bit, but we think we're going to be in a holding pattern probably into the end of June. You know, just doing what we're doing.
You can't really answer this question until that holding pattern is let go.
Right. You know, they don't want us to do no overtime unless it's emergency. And as you know, with all the people out here now, it's like the summer. You know, it's we got to figure out what's going to happen, you know. But I don't think we're going to be opening it up come the end of May.
Okay. Well, thanks, Alex. Mike?
Yeah, so we're a little bit like night and day compared to Alex down there on Long Island. Up here, you know, in Finger Lakes region, in Palmyra, especially Wayne County, we really haven't had near the issues that the rest of the state, you know, especially downstate or west of New York have experienced. We, as far as road work, I have not made any changes to our road plans for the summer yet. Certainly, I'm going to continue to evaluate. We had a little webinar or a little Facebook Zoom meeting there with State Association last week or a week and a half ago, particularly about the sales tax revenue and whether or not revenues are going to meet what towns are expecting. Certain towns rely more on sales tax revenue than others. I calculated ours in Palmyra, and we don't rely on sales tax as much as some other towns. So I don't foresee as big a hit potentially in my town compared to maybe other towns across the state. But certainly I'm going to, evaluate the road work and the revenue. And I told a lot of my Wayne County guys and counterparts that, really it comes down to communication and working with your bookkeeper. If you have a bookkeeper, that's what I plan on doing. I usually wait till the end of the summer season to kind of really get close with her and make sure I'm not getting out of bounds in my budget lines. But I think I'll probably start that a little sooner this year and make sure we're working together through the summer.
Okay, Rob, what's the state doing?
Hey, David. On the state side, we found ourselves having to scale back some of our normal beginning of season cyclical work just due to our staffing reductions. We focused our efforts primarily on the real safety sensitive, acute needs on the highway system, but we're finding ourselves slowly transitioning back to a full summer program. Capital construction, vendor place paving, and our staff paving, that remains priorities for us. Our plan is to do all of that work. We're just going to be ramping up our staffing in the next, couple of months, hopefully, so we can continue to do that.
Are there differences upstate versus downstate for the DOT?
Yeah, certainly. We see, like in the Finger Lakes areas and in, parts of central New York where we haven't really had the impacts. Our teams are really pushing us to go back to full staffing. Whereas, in the lower Hudson Valley and down on the island, clearly we know we need to be much more cautious down there. So I think our abilities to do our 100% of our summer program is going to vary, across the state.
As expected. Sarah, what's the construction industry doing?
Yeah, so construction industry, whether they're working for local municipalities or the state DOT or the thruway, is really location dependent. As far as trainings, which is something that we offer a lot of, especially in the springtime, when this all came to light in early March, we all of a sudden couldn't have these in-person meetings. So that's something that we've been trying to switch over to these Zoom type platforms or any sort of online platform, because just because all of this is going on doesn't necessarily mean that your training can lapse. Some of the training programs can, if the authority entity can allow an extension to that. Some of our programs, like our density testing inspection program, we've been able to extend that by a month or two so that we can get people into our online classes if they are going to miss the April or May ones. And we've been working with the New York Construction Materials Association for some of the asphalt trainings that they run and the concrete testing trainings that they run. So that's just something that we've had to really change moving forward this summer, being able to offer everybody those training plans. But as far as the industry goes, we're pretty optimistic that everything is moving forward within the highway industry. Obviously, budget pending, all these tax revenues pending, but we're pretty optimistic.
Okay. John, Kathleen, or Fred, any updates or changes from what you've heard? Otherwise, we'll move on to the next question.
This is John up in Orleans County. We've gone through some temporary layoffs here at the county level. So I'm down, we're back full staff, but I'm also down three people due to temporary layoffs till at least July 31st. We've made the decision to, obviously we're moving forward with all our Fed aid, capital projects that we have, but as far as some of our CHIPS projects and local capital projects, all local capital projects are on hold for the time being. And our CHIPS projects, we're kind of we're moving them forward. We're finishing up 2 projects that we kind of had, couple phases to that we did last year. So we want to finish those out. But as far as progressing any further capital CHIPS projects at this point, we're going to kind of sit back, finish up those projects, and then, take a new look at what we have planned for the rest of the season and see how things go. We had a meeting amongst all of the other towns and villages day before. And there are some towns that they've been told that not to spend any money at all. So they're putting all their stuff on hold. And then there's other towns that are going full speed ahead, trying to get things done and moving things forward. So, but that's kind of what we're doing. We're kind of taking a little conservative approach just over the next couple of months to see how things pan out. And I got two other employees that have decided to retire because of all this as well. So I'm going to be down by the end of June. I'll be down 5 staff members. So it's about a third of my highway staff.
Kathleen?
Yeah, we're quite similar to what John is doing. We have been off, 100% of my staff has been off since March 19th. So other than my refuse, and then we recently called back the marina staff because they're going to open the marina on Friday. But all of our projects, other than our federal aid ones that have pretty much been underway, and anything that has been bid out, we're going to very cautiously move forward. But we've been told the same thing. Between sales tax and the uncertainty of the state revenue, we're kind of in a holding pattern as well.
Okay. Before we move to the next question, Sarah, can you give an update? What was the New York State asphalt training that you mentioned?
So the program that we run is the density testing inspection, the DTI. And then the asphalt and concrete programs, I'll have to double check with NICMA which programs they run.
So that's for the construction inspection group.
Yes. Yep.
Okay.
But if we're having that issue on our side, I just want to make sure on your side that you guys can be sure to fulfill those training programs as well.
Okay. So our next question is, how are supervisory staff maintaining social distancing and yet still meeting? In other words, how do you organize your work? And then the same question for your crews when they're out in the field. What are you doing to maintain those social distancing rules? Anyone want to go first? I'll look for volunteers.
Dave, I can go first. This is John up in Orleans.
Okay, and then we'll go to Chase next.
Okay. So what I've done is I've basically shut down our break room. A lot of people, we used to gather in the break room, and we were kind of packed in there like sardines. So we've now moved our workload planning meetings and stuff into the shop area where we have an ability to socially distance. I also require everybody to wear their mask, even if they are still 6 feet apart. It's just that extra level of precaution. As far as when we're out in the field, everybody's wearing a mask, whether we can social distance or not. So we're just kind of making sure that we are presenting or giving people the perception that we're taking every step possible to, combat this virus and help with, reducing the spread. So we're still doing things, we're just finding rooms and areas that we can spread out. And like I said, we had that meeting amongst all the other town and village superintendents. And the good thing is my shop is pretty big. So we were able to get everybody in the shop floor. We just stood there and 6 feet apart in a big circle and had a meeting. So.
Okay. Chase?
Yeah, can you hear me? So yeah,
Yep.
Same thing here, basically. Only difference, we have pretty much assigned employees to a specific piece of equipment and or vehicle, so that we're not seat swapping vehicles. They kind of have their own thing, and just trying to get them out on the road working where we're pretty much socially distanced anyways. So I have one guy assigned to the shop just to make repairs and stuff. And same thing, we closed the break room, and we're doing our meetings out in the shop where we can be separated. And we have this stuff here. That's about it.
Yeah, I see other people have it too. So, Alex, what are you doing out in the island? You're muted.
David?
Can you hear
Yes,
me?
go ahead, Rob. Okay, Rob. How about Rob and then Alex?
Okay.
Hey, David, on the state side, we find, just like everyone else, our facilities are a lot bigger than what you think they are once you look at them. So we're looking to identify multiple gathering locations throughout the shop, just where we can, break into smaller groups to do our meetings. The one thing that we struggle with a little bit is we stick all of our foremen in one office. Generally, we cram 2 or 3 foremen into one small office. So we got to figure out a way of breaking them up so they can have separate office space and not risk of contaminating one another. The one thing that we're struggling with right now is, when we do all of our mandatory safety briefings, we always have an OSHA sign-in sheet so we can track compliance with the training. We're looking for a way of getting some contactless signatures so we can track people and their attendance of this training without having them to have to touch a piece of paper.
Okay, Alex.
Well, I have 3 in the office plus myself. So what we have done is it's me every day, and then I rotate one of the staff members, whether it be my assistant or the union's clerk accountant or clerk typist. So where I keep away from them, I have a bigger office. So one in the office across from me, my assistant, she has email capabilities to get on the town's email from the home. We talk, we text, we clean constantly, and that seems to be working out. The clerk accountant, I can reach out her by text at home, and then when she comes in on her day doing the purchase orders and paying the bills, we're trying to catch up, because we fell behind. As far as the men, same as what you heard from some of the other folks, we're trying to keep one person in the truck. I try to do every other day, the guys come in and rotate. That way they don't forget their routine and know that, they're having a job. Some of them think it's a paid day off. They're supposed to be available at home if we need them. So one person per truck. Some are wearing masks. We're trying to keep the social distancing. In the lunchroom, luckily it's big. Each district has their own lunchroom, and they're separated. We try to tape it off, and we're doing the best that way. The trucks are coming in every day around 2:30, and every vehicle that's used by that individual is being wiped down. In the repair shop, we're using our steam cleaner a little bit more, hitting the vehicles that come in. Inside and out, more or less, and cleaning the shop heavy duty once a week. And we're also running the exhaust fans in the shop just to try to keep a negative pressure, so we are always pulling air out of the building and encouraging new air to come in. Obviously, the temperature hasn't been that good for us, so we don't have the doors open. I think we've had 2 or 3 nice days, but we expect that to continue, Dave.
Okay. Mike, you've got a little smaller facility than Alex does. So what are you doing in that tight little facility of yours and in the village too?
Yeah, so, I have the town crew and the village crew here. Initially, what we did here in Palmyra, even though it is a small town, we did drop down to the 50% crew. So our break room, when you talk about the break room issue, 50% of the crew not being around really allows us to maintain our social distancing in the break room. So we never did any changes to the break room.
Okay.
Last week, we went back to 100% with the town crew. We are still at 50% with the village crew. But, it's working out still. We, again, aren't really as severe up here in Wayne County, but we are obviously practicing all the social distancing policies, masks, cleaning. You know, as far as cleaning goes, the guys have been great. We clean in the morning, first thing when we get here. We clean at the end of the day. So everything's, you know, ready for the next day. So.
Okay. Anyone else want to give an update?
Yeah, this is Fred Penna from Putnam County. We've been studying the coronavirus and how it's transmitted. And so as we got additional information, we looked at our operations and studied how we could best prevent contamination and transmission of the coronavirus. So some of the things that we had learned was, you know, the lifespan on surfaces. That was important to us to understand because we were passing paperwork and purchase orders and other materials back and forth. We were receiving mail from exterior and wanted to understand if those are potentially contaminated items, how do we handle them? So we found out that on paper, you know, 24 to 36 hours was the lifespan on paper. And as you got into harder materials such as metals and plastics, they could last up to 72 hours. So we felt if we were able to quarantine our paperwork, then it wouldn't be contaminated before we moved it on to the next person. And then on harder surfaces, we use wipe downs. And we were having difficulty getting the alcohol solution, and until the New York State started providing some of the disinfectant, we were using bleach solutions to wipe down surfaces, and we took individual responsibility. So everybody, if you could take the cleaning or disinfecting solutions and wipe down the area around you, and if everybody did that, then we felt our surfaces were being disinfected on a regular basis. Then the masks were debated for a little bit of time. First, it wasn't to really, it was not really effective for preventing the receiving of it because your eyes are still an area of reception. But what it is very effective, and we're wearing masks right now, is the prevention of moisture droplets coming out as you speak. So if you have coronavirus, when you speak, you are, in a sense, contaminating all of the spaces around you. So it's in those closed environments that you want to have your mask on to prevent the moisture from coming out of your mouth. So we apply that to all of our operations, that thought process. So in those closed areas, and we also do the social distancing, and there were a lot of things that we're doing very similar. We're trying to keep our crews separate, drive to job sites separately, have individual vehicles for everybody. That helps prevent the contamination or people being in close quarters. So we're finding that, but if you can't, you have to wear your mask in order to prevent those closed areas or close contacts from spreading the coronavirus.
Okay.
That's pretty much it.
So what's the construction industry doing?
Yeah,
And then we'll
so
go back to Alex.
we've actually put together a plan that we submitted to the governor's office about reopening construction in the broad sense. So not just the highway, but the building side, but we'll stick to the highway for this meeting. Everything everybody's talking about is exactly what the industry is trying to do as well. When you're traveling to the job site or traveling on the job site, try and keep it one person per vehicle or sit as far apart as possible if that means the driver and then the passenger back seat. We've seen that masks when social distancing can't be achieved. So if you are an operator in an excavator doing a task all day and that's your machine for the day and you're off farther away from people, you don't necessarily need to wear your mask, personal preference. But if you're installing signs all day or silt fence and you have to work closely with somebody, masks are a must. As far as meetings, we've seen lots of different technologies coming into play. So for, say, the toolbox meetings that happen first thing in the morning, trying to get that 6-foot distance, as other guys were saying, You know, open it up to a circle and try and stand as far apart as possible. For some of the meetings that require the engineers to come on site, or other owners or different subcontractors and things like that. We've seen Zoom be used a lot, obviously, different FaceTime applications, GoToMeeting platforms. If you have Office 365, they have a really great app called Teams that has basically everything you could want. It's got the video feature in it. It's got chat features. You can file your paperwork through there. So, you know, from the office, you can post a form out there to your team that you'd like them to fill out, and then they can fill it out electronically and submit it back through that app. We've actually heard that the MTA has been using the Teams app very effectively to manage all of their projects. So we're just seeing technology come into the industry in really high numbers.
Okay, Alec, you had a comment you wanted to make, I saw.
Yeah, what we believe, and you know, it's a changing environment, as you know, but what we're trying to reinforce is when the men, we're a union shop, the people are getting paid their regular 40 hours, and they're working every other day. But what we're trying to make sure is when they are at home or when they go home, that they know and confirm to their family, you know, to keep the contact with other people to a minimum. You know, we don't think it's each other as much as our other outside contacts. And as you know, most highway workers do a second job, landscaping or handyman in that. And that's the tough thing, you know, they're supposed to be available, but some of them are working. But that's what we're trying to do, is the culture of when you go home, that's more than 50% of the problem, that you, your wife, and your kids, you know, they try to maintain the social distancing and limit contact with people. You know, that's what we're trying to promote here. And I think we're being fairly effective. I've had a couple of crew members come down with the coronavirus, tested positive. I don't think they got it from here because they were out in the beginning of March. And one is had surgery done, and I guess he got it while he was in the hospital and that. But we're just trying to make sure when people go home that their wives and their kids are all trying to reduce the amount of contact with the public, you know. The beaches have been very crowded. Last couple of weekends have been nice. And so that's what we're just trying to, it's a global policy, you know. It's not just at work.
Okay, that's a good idea. Good practice. Yep. Anybody else want to add into this question? Otherwise, we'll move on to the next one, and I do have a few in the Q&A pod.
That was an interesting point that Alec made. We also try to talk to our staff and reinforce the safety protocols should extend all the way to home. So when you get home, you're taking off your shoes. You're not tracking potential contaminated shoes throughout the house. You leave your exterior clothes that may have been contaminated throughout the day. Again, you try to quarantine these items as best you can and bring those practices to home, because that's the other half of you know, the cycle.
Okay. Well, I do have a couple of questions in the question pod, and then we'll move on to our next question. So let's see if I can get all the participants on the panel. There's a feature that you've got. You can give a, let me just find it, make sure. Nope, I can't see it on here, so you may not have it either. But real quickly, are your facilities closed to the public at this time?
David, this is Andy from Chemung County. Ours have been closed to the public since the middle of March. We do phone appointments, we'll use email, and we will meet with the public out in the field with masks on, socially distanced, but we don't allow any public into our buildings right now.
Okay, Alex?
Our office has been closed for about a month to the public, but I go to the window and I have a little barrier set up so they can't get close to me within 10 feet. We just completed our spring cleanup, so I'm pretty proud of the staff in the office and the field workers. We give out what's called a voucher. So your homeowner can hire a landscaper and take your leaves and brush to the dump for no feed disposal. So I set up an outside drop box with a notepad, and we put them in Ziploc bags with the names. And if someone has a question, I'll simply open the window, talk through the screen, and I maintain about 10 feet. And again, we don't know when we will start to open the office to the public, but we're here, we're answering the phones and answering the emails, doing the
Okay.
people's work.
Joel, I saw you unmuted. What do you have?
Oh, we've been, ever since this started, no vendors, no salespeople, nobody from the outside has been allowed in, just the highway crew into the highway garage. And your next question coming up, we've added extra cleaning too. So, yeah, no outsiders.
Kathleen, you unmuted?
Yes, David. We have been closed to the public. My offices have been closed to the public since March 19th. However, we're the point of distribution for our emergency operations center here. So we have folks coming in and out of our shop almost regularly, but it's certainly big enough we can social distance, and they wear the masks when they're uncomfortable or they need to get too close.
Okay. Fred, and then we'll move on to the next question.
Right, so in Putnam County, we're studying how to reopen the public spaces, and the two things that are, I think, being focused on are the plexiglass screening. We're looking at those for the main interface with the public areas, and then requiring masks for anybody entering in those buildings. Those are the 2 points that are coming up right now. We're looking at some of the interaction between employees where there are crowded spaces, but we're moving forward to prepare for a full reopening of the county.
Okay. So our next question we had, and there are some in the Q&A pod, but we're going to answer them here as we get through these. I want to make sure we get to all of our questions. Are you measuring temperature or other vitals for your employees as they start today? Is there anything special you're doing when they come into work?
Dave, this is John. I can tell you what we're doing here in Orleans County. So when my employees show up for work in the morning, I have a log sheet and a touchless thermometer. They come in, they take their temperature. We ask them to just check by their name for that date that they checked their temperature. If anybody has a temperature that is 100.4 or higher, we ask them to go home, contact obviously their primary care physician, or go to urgent care and stuff like that. We do not record their vitals and or their temperature because of HIPAA rules and laws. So we don't want that information out there. We've been instructed by our attorney and and even the health department to not do that, but just to have them check it, kind of like an on your honor system that they've done it and that their temperature is normal. So that's what we're doing.
Okay.
In Putnam County, we were considering the temperature as a entry test, but then we found out that you could be asymptomatic and still have the coronavirus. So you could be contagious for a period of time. We also know the Veterans Association verified that. They were doing temperature tests and then canceled it because you could still be contagious. But if you developed symptoms, you were supposed to not come into work. That was the only restriction that we had until you were symptomatic free for 48 hours.
Okay. Joel, Rob?
Hey, David, on the state side, we're in discussion about how we can properly, manage our, these the features of our staff when they're coming in. We've talked about measuring temperatures. We've talked about having them go through a questionnaire. And we're really just trying to work out the logistics of it right now. I think it's something we're interested in doing, but we're just trying to work through some of the labor management concerns, as well as just simply the logistics of making that happen.
Every morning we always ask, and it kind of gets a chuckle out of everybody, but we always ask, hey, is everybody okay? How you feeling? And, you know, everybody answers honestly, so.
That's an important question. So and you know, we have it during the normal flu. People will come in and not go out sick with the normal flu. If someone is sneezing or is demonstrating flu-like symptoms, will we have the right to tell them to go home and not be in the office space? Is it a personal decision, or is it a decision that can be made by management?
That's a good question, Fred. I don't know that I have the answer for that one. I don't know what others are going to be doing about that either. Sarah, what's the construction industry doing about workers?
So we don't advise taking their temperature. As John was saying, there is some HIPAA issues with that. So we recommend having either a medical professional do it if you have a medical professional on staff. Otherwise, having them take it themselves and then just kind of self-certify the same thing. If they're feeling okay that day, self-certify that. If our understanding is that if an employee is having symptoms of some sort and the group doesn't feel comfortable having them at work, I think it's a well-known fact that especially in construction, you know, we're tough people. Nobody likes to take a sick day, but we're trying to change that culture. And on the private side, a lot of the industry companies, you know, will give them sick days, even if it's not what was negotiated once upon a time. Give them PTO days, have them sort out the symptoms with their doctor. And then once the doctor has issued a note that they're either clear, that they don't need to be tested, or they've been tested and they tested negative, they're good to come back to work. And then there's also, you know, federal rules about medical leave and sick leave and things like that. But I'm not 100% sure the lines between a municipal employee and a private contractor employee, so I don't want to blur those lines.
Okay, I'm going to move on to a different question. Have you changed any of the protocols for specific jobs due to COVID-19 concerns? Chase, go ahead.
Yeah, so one thing we did is when we're hauling our stone out of a particular supplier's quarry, we used to have to stop on the scales, go in the office, sign a ticket. So everybody's exposing everybody there. We talked to the quarry before we started, and they allowed us just to pull on the scales. They would wave us on, and I just signed all the tickets at the end of the project. This was for making cold mix. So that's just one thing. One protocol we had was the truck drivers couldn't go in the office.
Okay, Chase, anybody else?
David, this is Andy from Chemung. We have a lot of interaction with the public at our compost facility, so we had to make some pretty big changes there. In the past, we would have gone right up to the window, we would have had them sign, we would have looked at their driver's license to ensure they were a county resident. Now, windows stay up. We allow 5 vehicles at a time into the compost facility. They're directed where to go. We also, instead of having them sign and look at their license, we just take a photo of their registration. It's not as much information, but we figure if there's an issue, we could always track them down if we needed to. And it's worked well. We've been able to push through at our small facility about 400 plus cars a day. And the public's been very pleased with how it's gone. 20-minute wait at the most in line, and the busy time of the year. So that's been the biggest part for us, is where we have to interact with the public. We try to drive separate vehicles to the job site. There's only one vehicle we have where you could actually be 6 feet apart, but it's such a small space, you still don't want to be in it together. So we were, after the storm last week that we had people out checking roads in 10-wheel trucks just to keep them separated from other employees. You do what you can to keep everybody safe.
So Andy, do you allow your employees to drive their personal vehicles to a job site?
We do not at this point. It can get into some legal issues. So we want them to come to work. We don't allow them to congregate before or after work, and then get a county assigned vehicle just to keep our insurance and liabilities in the proper place.
Anyone else got some examples? Alex?
With UPS and FedEx and that, again, I have the drop box outside. They're kind enough not wanting to have us sign anything. They'll simply just ask me what my name is, and they'll either just punch it in their little handheld or just, you know, put my initials down and that. And again, in the shop, that's where we have trouble keeping, you know, there's a lot of activity in the repair garage, 5 mechanics. So that's why we're stepping that up with using the steam cleaner more, heavy duty cleaning, and with the exhaust things that you would put on the stack when we're running trucks in the shop. We run that thing while they're there all the time just to try to pull the air in. But we kind of believe it's just like safety. It's a culture that has to be constantly positive reinforced so people get it, you know. We're fighting something we can't see, and with the disinformation out there, you know, people you know, tend to get lax. So that's why we're trying to I speak to the foreman every day that's on, or the assistant foreman on the other day, and make sure they're wiping down their equipment. And as the others said, driving separate vehicles. No, we don't let people drive their own vehicles to the job site, but we do try to keep them separated. Like if we run the garbage packer, we have a guy following a small pickup truck, and he just puts the chain, you know, the hook on the thing on the dumpster and dumps it, gets back and follows the truck to the next job. But I find you constantly got to reinforce it for them to really get a hold of it, because you can't see it.
Good point. Very good point.
Hey, David, on the DOT side, our materials section is working with our asphalt producers to work out a contactless ticketing system for receiving deliveries. I think they got a little work to do on that yet, but they anticipate having some success in there very soon. As far as folks driving their personal vehicles, we have been experimenting with that a little bit. We've done that historically over the years for some of our mowing crews that work in you know, remote locations. They'll drive their personal vehicles there. But we're going to start managing it on a little higher level now, having some additional folks do it. But there's obvious concerns with, you know, with personal insurance. We want to make sure people are simply using it to drive themselves. They don't have other passengers. They're not hauling equipment or materials. You know, so certainly those are some of the concerns that we need to make sure we manage.
Okay.
David,
John,
we've taken,
Joel, go ahead.
yeah, we've taken a couple places that the guys are there full time, like example, the cemetery, and we've put down there a tickle, and the person just goes right there, and so he reports to work every day right there, and then uses the town vehicle instead of coming here. So.
Okay.
Is anybody considering deep cleaning of their space? That's one of the things that we continue to debate at this point, although I think we're concluding that, and it was very expensive. We did it at the EOC. One of the 911 personnel came down with COVID, and they went into this deep cleaning mode. And it was something over $10,000 to clean the space. And then that became like, you know, then everybody wanted a deep cleaning of their space. And again, they were on ladders and they were cleaning up to the ceiling and all of this. And when you looked at how COVID, again, gets transmitted, even if it reaches up high, no one is going to go up there and touch it and then transmit it. So, I mean, I didn't see an effect, you know, the usefulness of it, because again, it's also just a one-time cleaning. The next day when you have traffic in there, you're exposing the space to potential contamination again. So I don't know if that's been going on. I think we're circling to not do that. We also, as we're talking about reopening public spaces or office space, the deep cleaning issue came in. Well, let's deep clean everything before we go in there. And the conclusion was, again, those spaces have been dormant for over 72 hours. Any coronavirus that may have been in there is no longer in there. So I don't know if anybody's struggling with that issue, but that's what we're dealing with.
Hey, Dave, this is John from Orleans.
Go ahead, John.
So, Fred, along the lines similar to you, there's been questions, looming how deep do we get into cleaning these spaces? And, you got carpeted spaces, you got hard floor spaces, you got keyboards, you got computers, screens, what can you use that's safe for everything? One of the things that, being a firefighter as well, the Tulsa Fire Department down in Alabama had devised a way to utilize like an old air pack as a compressed air system. They went out and they bought like a really cheap Harbor Freight spray gun for like $15 and some fittings to connect it up to their air pack to make kind of a mobile disinfecting unit. And they're using like hypochlorous acid, which is a natural product that is used for disinfecting. And by using that paint spray gun and stuff like that, and being able to have it like on a backpack harness, you're able to go around and spray things very quick, very fast. It sprays out in such a fine mist that it basically dries on contact. And with the hypochlorous acid, within a minute of contact, it kills the 99.9% of all bacteria, germs, viruses, things like that. We went up, I contacted our EMO. We have some extra air packs that they, are out of date and stuff that we are now looking at converting over, utilizing that system to start trying to be able to go around and do a broad-based disinfecting of all of the facilities, desk space, computers. The hypochloric acid can be used. Chlorous acid can be used on keyboards and things like that, without damaging them. So that's the steps or the direction we're kind of moving in as we kind of get closer and closer to looking at opening back up to the public, as to how can we maintain a disinfecting program that is, effective, but also efficient.
That's a very interesting point. We were looking at sprayers, paint sprayers, and other things that we could use to quickly spray down areas. Some of the questions that came to that, though, were on electronic devices, your dashboard, your phone. I mean, the phone is another item that's in tremendous exposure constantly, and, bringing it up to your ear and your face is not a good idea unless you wipe it down. But our computers and stuff like that. So yeah, the spray could work in a lot of situations, and we're looking at that. We wrote down the hydrochloric acid material.
Hypochlorous.
Hydrochlorous.
No, hypochlorous.
Hypochlorous.
Yep.
Yeah, what he's saying essentially, Fred, is be very careful. Some things will damage electronics.
Yeah.
You might even want to test it before you did it on something that you're not too worried about.
Right. So in that sense, the wiping of keyboards and phones and things like that is what we circle to. You wet a paper towel and then you wipe your surfaces down. In other areas, you can use the spray as a quick disinfectant. But when you talk about product, has anybody heard of the Durasan product, which we still haven't been able to get a hold of? This product comes with a fogger, and you can fog an entire room, and it leaves a disinfecting film on all of the surfaces for 30 to 90 days, and will kill viruses for that long. But we haven't been able to actually acquire it. We had an order in, it was very expensive, it was $28,000 was our order, and then it was intercepted by FEMA. So before we got a hold of it.
Before you use it, Fred, I'd want to make sure it actually worked. Be careful of claims.
Well, actually, we actually used that. We had it. We used it up. So what we had, we got early on. We sprayed all of the EMS and the Sheriff's Department and the ambulances in the county. That's what we did through our EOC, because they had the Durasan, but we can't get any more. I'm hoping to get some so that we can spray our trucks, and it so far seems to be effective at least 30 days. We'll see how much farther out it goes, but so far so good.
Okay. We had a question in the question pod, which I think sort of relates to all this, and then we'll get to our last two questions as we're getting close to the end of our hour. Have you had, other than that obvious issue that Kathleen just raised, issues getting other safety supplies, masks, cleaning solvents, items like that related to COVID?
David, this is Andy. I would say that early in this process, we had issues getting cleaning products. The state's disinfectant that they provided has been helpful. We've been able to get masks recently that we couldn't get early. So I think now it's a different answer than if you had asked me 4 weeks ago or 6 weeks ago. It's much more readily available.
Okay. Kathleen?
Yeah, we are still having difficulty, although yesterday we did get a shipment. It wasn't what we asked for, but we got a shipment of PPE, so we're certainly going to use it. But we have been having difficulty getting our PPE as well.
Rob, how's the state doing?
We've been pretty fortunate with our stockpiles. You know, all of our locations had a small supply on hand, so we've been able to use those. We do go through, much like all the county EOCs, we do go through the governor's PPE task force to make requests for PPE when we do need some, and we've been using that for some from disposable surgical masks. But we've also gone out and done large acquisitions of cloth masks for all of our employees. Right now, we've outfitted all of our employees with 2 masks, and we have another order pending where we'll be able to give a 3rd reusable mask to all of our field staff.
Alex, what's it out on Long Island? Has that been an issue for you?
Well, like everyone else in the beginning, we had oodles of everything, and then slowly it got a little tougher. I did end up getting some cases of bleach and some buckets and clean rags, and told them in the event they run out of wipes and that, you know, a cup of bleach to 2 gallons of warm water and use that to wipe down. We've seen lately some of the new vendors coming out with these different mechanics in a can. We've seen some fogging of a vehicle and some of the aerosol alcohol and that. But as much as, you know, again, personally, I think the personal hygiene is by far, as another speaker mentioned, the droplets from when we speak. You know, I think those are the hot items. Touching your mucous membranes, your face, your ears, your eyes, your nose. I was the infection control guy for my Legion ambulance, and we're handling this like tuberculosis. And we find that's the thing. You know, I did this one thing where I showed the class how to put on their gloves and take them off safely, but I hid fluorescent powder in the gloves and I let them go on with the class for 45 minutes. And then I said, okay, let me show you how often you touch your face. And with the black light, they were covered. So
Yep.
again, the personal hygiene, washing soap and water is very good, very effective. And that's what positive reinforcement, that's what has to happen. Hand washing, face washing, you know, and masks to try to prevent the droplets from being projected, you know. We wipe down, some of the spots are wiped down so much, it reminds me of a kid when my mother and father smoked, where you could see the nicotine running down the wall or a counter, you know. So we have cleaner on top of cleaner, but I still think it's the hand washing, the face washing, as another speaker said, the clothes, the boots, you know. I think that's the money, reducing contact, keeping distance. Just
Well,
saying.
that just because of time, and also I think this is an important question we've had asked of us a lot. So it's up on the screen. How do we reduce risk to an acceptable level? And actually, Sarah, if you want to go first, I want to see what construction industry thinks in this. How are they going to answer this question for their crews and their work?
Well, this question's kind of, you know, it's location dependent again. If you're in the North Country or you're in the, you know, central part of the state, this is a very different atmosphere than if you're in Buffalo, Erie County, New York City, Long Island. So what an acceptable risk is to the general public right now, I think those are two very different perceptions. But within the job sites and things like that, reducing things to an acceptable level, what is that acceptable level? As we wait for May 15th to come and we get some more guidance from the state, that might help clear things up a little bit. But as Alex said, I mean, nothing replaces good old fashioned washing your hands. It's super effective. Washing your hands, providing those sort of receptacles and things like that will help reduce risk. You know, really teaching everybody about what they do when they go home, what they do with their clothes and things like that. And I feel like this is a lot of reiteration, but I think everybody here has it on the money. Everybody's in the right direction. And then traveling has been a big thing for our group. Is if you reside in one part of the state and you're working 3-4 hours away, you know, to what extent may you be bringing something to that community or bringing something home from that community? If you have to stay in a hotel while you're there, or eat out, or eat in rather, you know, let's assess that. If you're going to be coming from Plattsburgh, do you really want to go to Westchester, and maybe bring something home? So those are risks that we're assessing per the contractor, per the contract. If they're working with DOT or something like that, really, you know, hashing out, can we change the schedule a little bit? Can we bump this item 3-4 weeks down the road to see what the landscape looks like there? It might just be better overall for everybody. And maybe it won't, if it's not a critical path item, maybe it won't have such terrible schedule impacts either.
Okay. Anyone else want to try to answer an unanswerable question?
It's like any risk, I think. You know, you look at the risk, you see if you can eliminate the risk, if you possibly can engineer a solution to reduce the risk, and if not, then you rely on PPE and procedures and safety protocols in order to prevent injury.
Alex, you unmuted yourself.
I agree. I try to use my OSHA training. Universal precautions. Everyone's sick. You assume everyone's sick. Engineering controls, social distancing, hand washing. These are the things. I tell my workers they're essential and we need to come in, especially the public needs to see us doing our job and keeping the roads safe. So I think we follow these recommendations and we'll get through this. You know, down here on the flat, we got the pollen of all sorts now coming on. So you have seasonal allergies. People are still getting bronchitis and the regular flu. So again, you know, universal precautions, everyone's sick. and try to just use engineering controls to reduce the chances of you picking something up. And then we'll maybe have a new world coming this way.
Anyone else? We'll give you a couple more minutes. We're going to run over, but that's okay. I want y'all a chance to answer this question.
Dave, if I could add one more thing, we haven't really talked about. Am I
Sure.
still on?
Yep.
I have 2 EMTs, 1 paramedic, and several ambulance crew members, and they're still making runs at night or during the day. And I try to talk to them as well constantly to see how they're doing, how their emotional state is, and what precautions are they doing. I certainly don't want to not encourage them to do their duty. They're volunteers. And I think other departments should take a look at that and talk to their people that are making first responder calls.
Okay. Anyone else? Andy, Joel, Rob?
Basically, it comes down to social distancing for us and a lot of lonely days. I kind of, it's akin to me to the question, how many deaths are acceptable from a traffic crash? 0.
Yeah.
So I don't think that there's ever going to be acceptable level of risk. As Alex said, we just have to manage that risk and do our best to do our job to keep the public safe.
Yeah, well said. Well, again, we're running just a little over, but I want to thank all of the attendees who stayed on. I want to thank all of our panelists again for joining us. This is an evolving thing. It's going to change even more. I suspect we're going to have new answers in a few weeks. So it's just the way things go. So keep that in mind as we move forward. We'll be doing more activities with the local roads program, so look for those if you're interested. And again, I want to thank all of y'all who joined us today, both the panelists and the attendees, for a great discussion. And have yourself a great day. Be safe. Stay well.
Thank you, David. You too.
Bye-bye.
Thank you.
Thanks,
Thank you,
Dave.
Dave. Thank you, everybody.